Hi, my name's Gemma Bryan. I'm a research fellow at the University of Surrey, and I'm here today to talk about the UK SPEEDY study, which is a study that we're hoping to start in the new year. So the title of this talk is Helping Children and Young People to Report Their Symptoms, Introducing a Tool into Clinical Practice. This is a collaborative study with the Sung Lab at Sick Kids in Toronto and is funded by the CCLG. I'm delighted to say we have 3 parent representatives who have joined us on the study. They've fed back into our plans for the study and also the information sheets for children, young people and parents, and will hopefully be with us through the duration of the study. Children and young people with cancer experience a great many physical, psychosocial and behavioural symptoms and problems, which may appear both during and after cancer treatment. These can be complex, co-occurring and can be interrelated. These symptoms and problems may relate to the cancer itself, such as a headache caused by a brain tumour, or may occur as a consequence of therapy, such as nausea caused by chemotherapy. There is significant variation in how symptoms are experienced and the level of distress that a patient may experience, and this can make it really difficult for healthcare professionals to predict just who's going to experience problems. Treatment delays and therapy reductions as a consequence of these symptoms may impact prognosis and can also cause declines in children and young people's physical and mental functioning, affecting their quality of life. Children and young people with cancer may have difficulty articulating their symptoms and problems, may hesitate to ask questions, may hesitate to report problems to avoid worrying their family, or bothering healthcare professionals, may be more accepting of experiencing a range of debilitating symptoms, and may only seek help when symptoms become particularly severe. The Symptom Screening in Paediatrics tool, otherwise known as SPEEDY, is a screening tool for children and young people with cancer aged between 8 and 18 years old. SPEEDY asks users about 15 symptoms they may experience during and after cancer treatment, including changes to emotions, body image, tiredness, mucositis, otherwise known as mouth ulcers, headaches, pain, neuropathy, nausea and vomiting, constipation and diarrhea. Users report how much each of these symptoms bothered them yesterday or today using a 5-point scale rated from 0, so not at all bothered, to 4, extremely bothered. There was also space for them to record any symptoms that aren't listed. SPEEDY has been found to be easy for children to understand and complete, and has been reported to be feasible for use in clinical practice with children with a range of malignancies, including relapsed and refractory disease. Thankfully, it's also been found to be really easy to complete. It takes an average of 1.8 minutes to complete SPEEDY. A version of SPEEDY for children, for parents and guardians, to report their children's symptoms called Proxy SPEEDY has been developed and validated. And there is also a version of the tool for younger children. So the electronic version of SPEEDY includes an audio feature that reads individual questions or the entire instrument aloud, if the child wishes, a list of alternative words for each symptom. So a user can listen or can see or listen to synonyms if they do not understand what is being asked, and animations of a dog which provides instructions when petted. SPEEDY also has a stars and sounds feature which appears after the child completes each question, so they know that it's been logged. The electronic form of SPEEDY is now available on a website called SPARK. SPARK stands for Supportive Care, Prioritisation, Assessment and Recommendations for Kids. And it's designed for use by children, family members and professionals. The goal of SPARK is to combine the identification of symptoms with the provision of interventions to prevent and treat symptoms that are detected. After SPEEDY is completed, a symptom report is created, allowing for the tracking of individual symptoms and overall trends over time. Symptoms that patients are extremely bothered by are shown in red on the symptom report, whilst things the patient is not at all bothered by are shown in green. Speedy and Spark have been developed and tested in Canada, used in Australia and France, and a cluster randomized trial is currently underway in the US, but hasn't been used in the UK yet. In the study, we're not going to start by creating something new. We're going to take something from another country, in this case Speedy, and apply it to clinical practice in the UK. So rather than reinventing the wheel, we're working with people who have done this very successfully before. The sharing of knowledge and the development of new knowledge will benefit everyone, especially the children that we care for. We therefore set out to investigate how we can use Speedy via Spark in clinical practice in the UK. This is a collaborative study which seeks to identify what works well and what does not work, in which groups of children and young people, and in what clinical contexts. This will reveal opportunities for generalizations about how it could be used by children and young people across principal treatment centres throughout the UK, facilitating its transfer into other settings more easily. So by allowing us to understand its use in a clinical setting within established routines by clinical teams in real time. It's well recognised that the most challenging aspect of intervention research is implementation and normalisation of the intervention. So we'll be using qualitative and descriptive methods to gather contextual information regarding how an intervention is both received and developed. An examination of the context of care prior to a much more expensive trial is important because such a trial could fail through a lack of understanding of the environment and how an intervention is taken up in real time by children, parents and carers and professionals. Therefore, this early work is really important to gather information needed to inform the development of a future study on the use of Spark in clinical practice throughout the UK. So the present study will use a research method called process evaluation, and we have 4 phases to the study. The first phase is approximately 3 months long, and that's an organisational assessment in both study sites. We will then introduce Speedy into practice in a 6-month phase, which is phase 2, and then we will evaluate the use of Speedy and start developing a protocol and plans for the future study, which we'll need funding for. So this might take a while. So this first phase, the organisational assessment, we will look at the processes currently in place in each clinical settings and how Speedy via Spark will work within these settings. We're planning to ask members of staff working at each of the case study sites to take part in key informal interviews about the current workflow of the unit. We will create process maps and models for improvement and an implementation plan detailing how Speedy via Spark will be used in each setting. This will be really a collaborative effort using co-production. We're really keen to hear from staff what they think will work best and also what they think that won't work. This is really important. There's no point us introducing something if it's not going to work. So we will also include an examination of clinical practice in the UK through a national survey of professionals and a review of medical records to see what symptoms are currently being recorded in practice. And we're also going to review trial documentation to see what is being recorded within the context of clinical trials. In the second phase, 30 children and young people aged between 8 and 18 years old receiving treatment for cancer or undergoing a bone marrow transplant will be asked to use Speedy via Spark on their family's own device for 5 days at 2 hospitals in England. We will invite inpatients in Leeds Children's Hospital and patients attending outpatients and daycare at Great Ormond Street Hospital to join the study. We hope to recruit approximately 15 children and young people at each site. We will use plan, do, study, act cycles to test the plans we made in the earlier phase about how Speedy via Spark should be used in each setting. We will review how this is going at each site after every 5 patients, and then we will refine how Spark is used if we need to. Children and young people will be asked to use Speedy via Spark in the hospital and at home, if possible, if they were discharged or if they're a day patient. And as Spark is a website, it can be accessed from any internet-enabled device. We will also ask parents or guardians to provide a proxy report for their children's symptoms and problems for the same 5-day period. After they use Spark, we invite children and young people to take part in an interview. These interviews will take place in the hospital on the day the child is already meant to be there, or they will take place via Zoom or by phone. So in this phase, we also plan to check how children and young people understanding of the symptom terms. And so we're going to do this by inviting the first 10 people recruited into the study to take part in a short interview before they start using Speedy and Spark. So in this cognitive interview, we will check that they understand the meaning of each symptom contained in Speedy by asking each participant to explain what the term means in their own words, and if they use another word to describe that term. We also ask the same group of patients to rate the relevance of each of the symptoms contained within Speedy. This is a really small piece of work, and so it should only take about 10 minutes, 15 minutes before they take part in the main study. But it's important to make sure that the words we use in Speedy are the right words. In the third phase of the interview, third phase of the study, I should say, we will interview professionals and parents about their experiences of using Speedy. The data from the early phases will be brought together with these interviews to answer our research questions. In the final phase, we plan to use what we've learned together with what the Song Lab have learned in their work to inform our plans for a future study. We will refine our materials for teaching people about Speedy and Spark and identify outcome measures for use in the main study. And lastly, dissemination. We will disseminate the results of our study widely. A report will be distributed to all the participants and parents who took part in the study using a variety of formats. We will use social media to tell people about what we have found. We will also use more formal approaches to dissemination, including publishing papers, an article for CCLG Contact magazine, and presentations at both professional and parent conferences, internationally and nationally. Thank you for listening. Here are my contact details in case anybody would like some more information about the Speedy study, and I look forward to hearing your questions.